Hello everyone, and welcome to our webinar, COVID-19 Solutions, Chronic Condition Management. I'm Jennifer Koenig with Health Check 360. We have a great presentation for you today, but before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of the presentation. If you have any questions, please type them into the question section at the bottom of your screen. We will also be posting a recording of the webinar online. So if you'd like to replay this presentation at a later date, it will be available. Today, we have Health Check 360's Michael Kelly and Trent Tangen with us to share how to improve the health of your employees with chronic health conditions and why this is an important piece of your overall COVID-19 workplace strategy. With that, let's get started.
Thanks, Jennifer. The last few weeks we've been working through a lot of subject matter around steps companies can take to not only improve the health and safety of their workplace, but to really protect their employees long-term from the impact of the COVID-19 virus in the unfortunate case that one of them might contract it. And that's kind of specifically what we're going to talk about today. As we think about all of the steps, we've talked about daily symptom tracking, so making sure that people are aware of symptoms, and if they have COVID-19 symptoms, to not come on site to your workplace or your facilities and potentially transmit that to others. We've talked about how to add that with on-site temperature screenings in order to create a series of hurdles that employees must pass in order to get to work safely and prevent the spread of the virus. Last week, Trent talked about the case management of opportunity for COVID-19, and this is kind of a continuation of that conversation. Last week, we explored the reality that many companies are creating tools to prevent people from coming to work, but what happens when someone has the virus? How do we support them effectively and in a cost-efficient manner? Number 4, we talked about antibody and PCR virus testing for COVID-19 as a tool and resource for employers. And today we're going to talk about diabetes and hypertension management. We call that compliance management. Many people call it condition or disease management. But the reality of it is that employers really need to be thinking about all of these components together for a lot of reasons. Number 1, maybe first and foremost, is to limit the spread of the virus. We have an obligation to ourselves and our employees to make sure that we're doing everything that we can to prevent the spreading of the virus at our workplaces. And that's especially important, unfortunately, because we want to mitigate employer litigation risk. Although Congress is certainly debating potentially legislating some of this protection for employers, the reality of it is that not a day goes by where we see a news article where a major employer is being sued by employees for not doing everything they can to protect them. And so one of the things that we want to do by providing all of these services is actually giving you the resources so that you can demonstrate and have a data record that you are asking your employees to do the right things, that you are taking the right steps to protect your employees at all of your locations and at all of your work sites. The third is kind of regulatory compliance. There's outsourcing certain of these components is much easier to maintain compliance as it pertains to the EEOC and other regulatory bodies. For example, we're not supposed to mix our protected health information from these processes with other standard payroll and other services. So we've talked to many companies who have an HR person or a general employee who's keeping track of these things via a spreadsheet or in systems that might conflict with some of the guidelines. And the last thing is either you can call it employee satisfaction. I like to refer to it as employee support. And I think that, again, the support is where this bucket falls, which is demonstrating to employees that you're providing resources that limits the unwanted exposure of this virus. Said far more simply, employees have responded very positively to employers when they've rolled out processes and procedures that are designed to protect them even though they might seem invasive, even though they might seem an invasion of privacy, the reality of it is right now, people want to feel and be as safe as possible. And so as we transition in the conversation around condition management today, there's really kind of an unfortunate truth, and that is very specifically people with chronic conditions, more specifically diabetes, heart conditions, and obesity, are at a far greater risk for complications from COVID-19. We see this from the American Diabetes Association. We see the same thing from the American Heart Association, those with hyperlipidemia or hypertension and other heart health issues. The American Heart Association says in those with chronic medical conditions, the body's immune response is not as strong to respond to such a serious virus like COVID-19. And so these are a lot of words, but what does this really mean? Well, the data is really starting to come out, and this is from the CDC, and this is data collected in New York City with as recent of the end of this past May. And what you see is the highlighted circles here are adults that were confirmed hospitalized. So hospitalizations with a COVID-19 positive test as of May 30th, 2020. 34% had cardiovascular disease, 57% had hypertension, 42% had some type of metabolic disease, which is most always associated with a combination of risk factors or general wellness. And the last piece is 40 or essentially 50% of all of the hospitalizations had a BMI greater than 30. And so there's a real strong opportunity here to control and think about these, how do we maintain compliance and improve the ability of our employees to manage these disease states. So if the unfortunate condition of COVID-19 is combined or they receive the virus, that we don't get the worst case environment. And I think that's what this chart is essentially saying. This is a study done in China early on by their Center for Disease Control. And what they found from a mortality rate for those with heart disease was 10%. Those with diabetes was over 7%. And you can see the other heart issues, 6 and 6.3%. So before I kind of turn it over to Trent to talk about how to effectively manage chronic conditions and the specifics of our program, I pretty much kind of want to sum all of this up, that historically I would argue that there was one primary reason that employers invested in disease management, compliance management, or chronic programs, and that was largely to save money on a health plan. We know that nearly 40% of our populations has one of these comorbidities, and because of that, managing those conditions appropriately was a significant opportunity to save dollars to the health plan because it prevented admits to the emergency room. It prevented complications, and all of those things obviously equate to dollars. Today, I think it's a different conversation. Today, we're talking about driving compliance, because if somebody with a chronic illness contracts COVID-19, being compliant with their medication, being compliant with their care management programs, and being compliant with their doctor's orders and medical best practices might actually prevent hospitalization and, more importantly, the potential for death as a result of the disease. And so, not trying to be morbid, but the reality of it is I would challenge everyone on the call today to think about as Trent works his way through our program and the importance of compliance, to think about if they don't have a program today, when would they bring one on? If they're having conversations with their benefit brokers for 1-1 and their benefit plans, should we be taking some of the money that was saved from the lack of voluntary procedures in 2020 and thinking about reinvesting that into the health plan to invest in our employees to prevent and improve their ability to maintain compliance rates? So with that, I am excited and happy to turn it over to Trent to see how we accomplish exactly those challenges.
Thanks, Michael. Before we dive into overviewing the Health Check 360 condition management program and our approach to helping participants manage their chronic health conditions, I want to just point out one thing. Michael really talked about the risk factors associated with participants with underlying health conditions if they contract COVID-19. And there's a word that he said a couple times over, and that's prevent. And there is a lot that we can do to help prevent some of these complications, and it really comes down to compliance. If somebody has an underlying health condition, it's essential that they continue to manage that condition, take their medications, be in contact with their primary care provider, be mindful of the foods they're eating and their activities, and checking their blood sugar and blood pressure on a regular basis. And that, in essence, is really what we're trying to do. That's the aim and the scope of Health Check 360's condition management program is to support participants with that journey and guide them every step of the way to make it as easy as possible to manage and maintain their health. So the way that we really kick this off is using data. So we're going to work with your payer to collect medical claims and RX claims. And we're going to mine the data to see what participants are being treated for what conditions. And so if we find somebody that is being treated for diabetes, and we know that off of medications they're taking or off of diagnostic codes that we see in claims data on why they're seeing their doctor or having lab work done, those are the people that we're going to enroll in the program. We also will use biometric data. So if you are completing biometric screenings, whether that's with Health Check 360 or another wellness vendor, we're happy to collect that data. And what we can learn from that is people who have an underlying health condition, maybe they don't know it, and therefore they're not seeing any medical claims. So an example would be if you do a biometric screening and you have a participant with a hemoglobin A1C, that diabetic indicator, at a 6.9 mark. That is somebody that is at risk and likely will be diagnosed with diabetes. But if they're not going to their doctor, maybe they don't know they have diabetes and they're not seeking treatment yet. Therefore, we're not seeing that information come through across in the claims. So with the biometric data, we can reach out to this person, educate them on their results, and enroll them in the program and help them to establish care with the primary care physician and begin their treatment. So step one is really basing everything off of data. From there, we're working with participants to complete all the recommended cares that their primary care provider would want them to complete. So these are all evidence-based cares. So for example, somebody with hypertension, we want them to see their doctor on an annual visit. We want them to take their medications as prescribed, and we want them to have their cholesterol and lipid panel checked regularly. So that's what we're talking about, is helping people to complete those recommended cares that their doctor would want them to complete, but are also evidence-based care guidelines that we know that anybody with these underlying health conditions should be completing, because if they do, they're better managing their overall health. We also utilize auto-enrollment, where some of the condition management vendors in the industry, they might identify people that have an underlying health condition and then provide an outreach and ask them if they would like to participate in the program. Where with the Health Check 360 program, we think it's essential that they participate, and so we have an automatic enrollment process. So if we identify somebody as having a health condition, they are automatically enrolled in the program. From there, we support participants on a regular basis, and I'm going to go over several different communication strategies that we have in the upcoming slides. But really we have a targeted approach to reaching out to people to assure and assist them in closing any gaps in care, as well as helping them if they have, if their blood sugar readings or blood pressure readings are elevated or are increasing, we can reach out to those people to see what's going on and support them along the way. We'll also help with plan design information, because really at the end of the day, it comes down to participation and engagement. We need to have an incentive structure set up that really drives people to take interest in the program and to complete all the action steps along the way in order to, again, best manage their overall health. So along with completing all the recommended cares that their primary care provider would want them to complete, we also want to help participants to address the underlying health conditions and lifestyle factors that might be leading to their chronic health conditions or potentially progressing their chronic health condition. And so we have an outreach program where we're going to work with participants throughout the year with regular information that we'll send out. content such as items that are specific to their condition. So understanding what diabetes is, understanding what hypertension is. If you do have one of these conditions, how to accurately measure your blood sugar or your blood pressure on a regular basis. Understanding the role of medications and why they are so important, and why you shouldn't just stop taking medications if you do see that your blood sugar levels have improved and have leveled out. Sometimes we'll see people say, oh, my blood sugars are good and I'll just stop. We want to make sure that they understand that the effect that medication is having to maintain that healthy blood sugar or blood pressure level. We certainly want to help with lifestyle pieces. If there's changes or improvements we can make with nutrition, with exercise, stress, sleep, all those have a profound impact on the participants' overall health and their biometric data, as well as their daily blood and blood pressure measurements. Also, establishing motivation and ongoing support. This is a condition that nobody wants to have diabetes or hypertension. So there's some stress in that, and being diagnosed with these conditions and having to complete these extra tasks. But we know that they are essential, and we really want to support people to find that motivation and that ongoing support to continue to manage this condition on an ongoing basis. They're likely to live with this condition for years, if not the rest of their life. And certainly we want to help them to alleviate some of the side effects, but we know that it's something that they're going to have to address. So we're going to support them along that way as well, along with understanding what happens if I don't take care of myself. That's certainly a piece of this, and how that impacts their overall health, their mood and their energy levels. And ultimately, at the very bottom there, their activities of daily living. Your ability to take care of yourself, to cook food, to do your laundry, to go to the grocery store. Those types of things all can be impacted. And we want to work with participants throughout the year to address these things so that they can live a long, healthy, happy, fulfilling life. So to support participants, we really have a robust communication strategy. The first step that we're going to do is once we enroll somebody, we're going to send them a welcome letter. So a home mailing to their home address that outlines what the program is, welcoming them to the program, and any incentive structures that might be in place related to completing all the cares in the program. On that first reach out, we're also going to have instructions on how to download the MyCare 360 mobile app. So that's a tool that the participant will have 24/7 access to. And it is a key part of the program that can support the participants because, again, they have 24/7 access. They know what cares they need to complete, when they need to complete it by. There's tracking tools on it, but also there's push notifications, so reminders to close gaps in care. There's also going to be weekly condition-specific content that I alluded to on the previous slide. So just constant reminders, education, support, motivation to the participant, and that come in a variety of ways, whether that's email or push notifications to the participant. There's also quarterly care reminders. So at least on a quarterly basis, we're going to be reaching out to participants to help them understand if they do have any gaps in care that need to be closed, any appointments that need to be scheduled. And we'll send them a home letter so that they understand where they stand in the program. And if there is something that's overdue or outstanding, we're going to reach out to them telephonically to support them and answer any questions they have and support them in scheduling that appointment or refilling a medication, whatever support they might need. Additionally, Health Check 360 always has monthly wellness webinars on a variety of topics related to managing overall health, as well as a Health Check 360 blog and social media, which are great content points where we can always keep Health Check 360 top of mind for the participant and keep them engaged in the program and always thinking about their health and what steps that they can complete next to improve their overall health. Before we dive into the MyCare 360 mobile app demo, I just wanted to point out a couple things and some feedback that we've gotten from participants on why they like the mobile app and how they use it. Most importantly is just knowing where you stand. So 24/7 access, you know always where you stand in the program and what appointments you need to get scheduled next, as well as reminders to schedule those appointments. So really the increased accessibility is key. There's also tracking tools so people can monitor their physical activity levels, their nutrition, blood sugar, blood pressure levels on a daily basis, and share that content with their clinician and talk about steps and establish goals and then to improve their overall health. They can also upload documentation. So I'll show you that feature, but that's really nice if somebody, let's say, takes a generic medication and maybe that generic medication does not come across in the RX claims file. they can snap a picture of their pill bottle and send it to us, and their clinician will get a notification and can review it and mark them as compliant if the medication does meet the needs of their condition. So a lot of great resources that are available to the participant, but the key of it is just providing access. So if somebody's on the road, let's say that you have a population of drivers and they're not at home to receive that letter or that phone call, the mobile app is another resource where they can gain access to the program and know where they stand. Another feature of the mobile app that I want to talk about is the ability for people to use the camera feature on their cell phone and to actually snap a picture of their glucometer and upload that data to the MyCare360 site. So I'll go over how that works, but this is really important, and our participants really like this for a couple reasons. One, it's very easy. So you don't have to use a Bluetooth glucometer, which tend to be more expensive, and you're always having to kind of work with, is my Bluetooth connected or not? Is my data syncing? Is my device charged? Those types of things. They can use their standard non-Bluetooth connected glucometer to upload their data. And another reason that participants like this is they don't have to learn how to use a new glucometer. So maybe they've been using the same glucometer for the last couple of years. They're familiar with it. They're comfortable with it. They know how it works. They maybe don't want to be introduced to a new glucometer that is, a proprietary one to HealthCheck360, let's say. They can use their standard glucometer or blood pressure cuff and upload their readings and track their data, which is essential, again, to managing their overall health. So without further ado, we'll dive in and take a look at the MyCare360 app. So the first thing I'll let you know is that that if somebody has their Face ID feature or thumbprint for security, that they can use those same login features just for easy access to access their mobile app. And as soon as we get logged in, you can see this particular user, they are 38% of the way done with all of their care. So top and center, they know exactly if they've got work to do. So this person is, they're on track, but they do have more tasks that they need to complete. It also tells you if you're up to date on your medication refills. So you can see very easily, green bar there, medication refills are up to date. If that was not the case, it would be a red bar that says medication refills need to be updated. Please contact your nurse. They scroll down and they can see their to-do list. So I know I'm not 100% of the way done with the program. So next step is, what do I need to complete in order to be up to date with the program? And so you can see down the list here, for example, this person has to complete a second A1C reading. They need to complete a second office visit. You can see there's a recommended date for completing that second office visit of 9/1 of 2020. And the reason that we can put in those recommended dates is really the goal there is continuation of care with your primary care provider. So somebody with diabetes, typically their primary care provider wants them to complete a office visit every 6 months. So based off of claims, we know that their first office visit was March 1st of 2020. And so we recommend they complete their second office visit 6 months later. So helping their provider keep continuation of care. You can see this person's lipid panel was due on 5/1 of 2020, and that's past due. So that turns to red, says past due. Here's what we need to complete. The lipid panel is due next. And then creatinine and microalbumin are also due later on in the year and gives recommended care dates. If we keep scrolling down, we can see what has been completed. So the eye exam, the first A1C, and first office visit are all complete. So I know what I got to do, and I know what I've already completed, which is a great first step. I can go into my program information, learn more about the condition management program and HealthCheck360, as well as have this paragraph here, which is specific to the client and overviewing the program criteria, deadlines, and if there is an incentive or penalty in place related to completing all the recommended cares. So for example, in this particular case, they need to complete all of the recommended cares by December 31st of 2020 in order to earn $125 per month premium. If I go back, I can come in and request a call. So they don't need to use this feature, but some people do like to schedule those calls. Any participant can call or email our team at any time, and we're happy to work with them. But sometimes if people know they're on the road and they want to schedule a time for when I've got a stop scheduled, they can put in when they want to be called, what phone number to call them at, and a little note about why they would like to be called. and then an email would be sent automatically to that participant's clinician, and they'll do their best to reach out to that participant at that time. We also have tracking features involved. And so again, people can track their food, enter all of their meals for the day, steps, their weight. And then another feature that we can use is with tracking glucose, something that we've already talked about, is the ability to use your standard glucometer in order to upload your glucose measurements. So if I come in, I have options here. I can either scan a device or I can enter it manually. So scanning a device is really quite simple. And so I can open up the list of devices that I can scan, and I'm going to use the Freestyle Freedom Light. That's the one that I have been using on a regular basis and I'm most comfortable with. So I can select that, and then I can just simply snap a picture of my glucometer, and it'll say your reading is 83. Select the time. I'm going to say that this was breakfast. Was I fasting? Yes. Any notes? And then I can submit that, and it tracks my glucose reading just as easy as using the picture on your phone. We also have the option for participants to connect to any tracker that they might have. So if they use Fitbit or Apple Health or Garmin to track their steps or minutes of activity, all of those, they can connect to the MyCare 360 app, and that data will come over automatically for that participant. And again, a really easy, convenient way for the participant to update their clinician on how they're doing with their overall health. Another feature that I mentioned previously was the ability to submit documentation. So let's say that I did complete this lipid panel. We would know that through the claims data. So a participant wouldn't need to go in and update it, but let's say that I completed this today. I don't like seeing red on my profile. I really want to make sure that I'm up to date with all of my cares. So a participant can go in, if they want to update their status of their lipid panel, they can come in and select the date. So today is the 18th, and I can take a picture. So I want to upload a document. I'm going to take a photo, and I can snap a picture of my lipid panel. Use this photo and submit it. So what's nice about that is as soon as I submitted that, my lipid panel went to pending review. And then an email was just sent to my clinician, and they're going to look at the lipid panel, and they're going to say, Trent, you just wrote lipid panel on a Post-it note. That's not going to count. And so they're going to reach out to the participant and say, you know what, that's not going to work. Or if they did, submit their lipid panel, we'll count that and automatically move that to-do item down to the completed list. So lots of great features, really meant to complement the entire program and make it as easy as possible for participants to know where they stand, and again, what are the cares that they need to complete. So moving back to the slide deck, we'll move on to how we can help participants to stay engaged and different incentive structures to put in place. There's really a variety of options that we see participants or clients do. It can be plan premium differentials, reduction in copays or deductibles, medications, so sometimes free generic medications if you remain compliant with the program, or gift cards, an incentive for completing all the recommended cares for a participant throughout the year. You can also look at the program in a few different ways, basing that off of compliance with care, as well as engagement with your clinician, as well as completing those daily activities such as logging your blood sugar and blood pressure on a day-to-day basis. And we can split those up. So maybe part of the incentive is based off of compliance with care, and the second part is based off of doing those daily habits that we know are essential to managing your overall health. And then it really comes down to reporting that we're able to provide. And so here's an example of one of our clients. They happen to be in the transportation industry, about 2,500 employees. And you can see in 2015 was their baseline year. That's when they started to use the Health Check 360 program. And the diabetes engagement at the beginning of the year, prior to implementing with Health Check 360, about 4% of participants diagnosed with diabetes were completing all the recommended cares that we would want them to complete throughout the year. And that's normal. That's typically what we would see. If we look at hypertension, we saw about 45% of people were completing all the recommended cares throughout the year. So then through the course of 1 year, we had an incentive structure in place and all of the communication and outreach from our clinical team. We're able to increase the diabetes engagement from 4% all the way up to 75%. And then we maintained, mid to upper 70s compliance engagement throughout the rest of the year. And with hypertension, similarly, we were able to go from 45% up to just shy of 90% and maintain that upper 80s, low 90s compliance rate throughout the course of the year for multiple years. So from 2015 through 2019. Then we're also able to utilize their biometric data and see what was the health impact compared to somebody who was compliant with their conditions versus somebody who was not. So let's take 2019, for example. We can look at those who are not compliant. They had an average Health Check 360 score of 48.3. So if not everybody's familiar with the Health Check 360 score, that's a scoring system that we use 0 to 100, 100 being the best score that you can have. And all of the scoring is based off of objective measures. So looking specifically at your glucose, your blood pressure, your lipid panel, so on and so forth. So using objective data, we can see that those who are not compliant had a score of 48.3. Those who were compliant had a significant improvement in their Health Check 360 score, all the way up to 62.2. That's an impressive improvement from one group to the next. And really it makes sense, because if we're able to get people to manage, making sure that they're taking their medications, making sure that they're staying active, helping them to eat healthier, we're gonna see their overall levels related to their labs improve. And then those who were not diagnosed with a condition had a score of 65.7. So again, we were able to get those with a chronic health condition to have a score nearly similar to those without a health condition. And so what does that mean in terms of claim spend? So here we're looking at the group of individuals who were diagnosed with diabetes. And over the course of the program, they had an average claim spend of about $8,000 per year. And if you compare that to what the American Diabetes Association says, is that the average participant with diabetes, their cost is about $16,700 per year. So we're cutting the cost of somebody with diabetes in half. Same thing with hypertension. The American Heart Association says the average claims is a little over $9,000 per year. And for this group, we were able to demonstrate those that were enrolled in the program, their claim spend was about $2,000 less, so right at $7,000 per year. So in conclusion, Michael really talked about the variety of options that are available to support people during COVID-19, and really how important it is that we support those with underlying health conditions. They are at an increased risk for severe complications, and there's a lot that we can do to help them to manage that risk. And steps that they can take in order to really prevent some of the side effects that are in place. So Health Check 360 really has a robust program where we're trying to help participants to complete all the recommended cares, as well as support their underlying health conditions and to improve their overall health. And so we have a year-round engagement campaign where we're working with participants throughout the year and supporting those who frankly need that extra support. So with that, Jen, I will kick it back to you.
Thank you, Trent and Michael, for your time today and sharing your expertise. We'd now like to open it up to our audience to ask a few questions. If you have any questions, please type them into the question section at the bottom of your screen. Trent, the first question is for you, and the question is about having a biometric screening. Is this a required component of the program? And then the next question associated with this is, do the biometric results need to be from a Health Check 360 biometric screening?
Yeah, that's a great question. Good point of clarification. So first question, is the biometric screening required? No, not at all required. It's a nice to have. As I mentioned in the slides, what we can do with the biometric data is really look for people with underlying health conditions that haven't been diagnosed yet. So there is an advantage to that, but again, it's not a requirement. But if you are utilizing biometric screenings, we'll work with any vendor. So certainly it's very easy for us to, if Health Check 360 is the biometric vendor, we're able to obviously utilize that data, but we'll intake biometric data from any vendor. So wherever that data comes from, we're happy to work with it.
Great, thank you. Trent, this next question's about the technology, and what about employees who don't have a smartphone?
Yes. You know, it's 2020, but there still are some people out there that don't have smartphones, and I understand that. So there's options there. One is there is a website, so people can use if they got a computer at home or in the office, they can go onto the MyCare 360 website and participate in the program. The other option is that, you know, really it's important to know that while it is beneficial to have a cell phone, it's not a requirement of the program. So we can still work with people through telephonic calls, through emails, and through home letters. So again, cell phone is a nice to have. It does make the program more convenient, but not a requirement.
Trent, are you able to work with medical carriers?
Yes. So we work with a variety of TPAs, medical carriers across the United States. And so able to work with them, and we do all the heavy lifting for you. So if you sign on and want to participate in the condition management program, our team will go to work on connecting with your claims payer, medical and RX, and making sure that we've got the file feed set up. We'll do all of that work and all of that conversation to make sure that we've got the appropriate data in place. But yes, we will work with any medical payer or third-party administrator, TPA.
Great, thank you. Michael, the next question's for you. Can you walk the attendees today through some pricing?
Yeah, absolutely. So we really want to make sure that we're pricing each deal exactly to the requirements and to the requests of that given client, payer, or associated party. So we actually take two major considerations into account when pricing. The first is how many total lives are going to be on the program. Obviously, with scale, we continue to discount the program. And the second thing is we actually allow our customers to customize the disease states. So obviously, our primary recommendation is that every group should, at a minimum, start with at least 2 with diabetes and hypertension. But we have programs for kidney diseases and other heart health conditions, and a variety of others to choose from. So, you know, the pricing with those two variables ranges from around, you know, $2 PEPM to $5.50 PEPM, but we want to customize that to you and your employee base. And so for more information or to get exact quote, shoot us a note and we'll get that right back to you.
Great, thank you so much. Michael, Trent, any final thoughts for our audience today?
No, I think that again, and I kind of know I said this in the beginning, but the reality of it is we used to think about disease management as a financial tool to control costs on the health plan. What we're excited about is the outcomes that we're getting from a compliance-based management, an incentivized compliance-based management program with easy-to-use tools that's not invasive. And what that compliance means right now in the COVID-19 environment is the ability to keep people off of the ventilators and to prevent deaths that are occurring right now in other parts of the country. There's just already in a very early stages of studying this disease that's everyone is dealing with. We're seeing that areas that have high rates of chronic disease, mortality rates are abnormally and saddeningly high. And that makes us disappointed because we want to do something about it. And frankly, I would just reiterate that if we're not targeting the chronically ill on your health plan today, as you talk to your brokers about what you're doing for 1/1/21, or if you want to start on 7/1/2020, we can make those things happen and start helping your population that's impacted by these disease states. And I think there's no better time than right now.
Thank you so much for that, Michael. I hope everyone enjoyed today's presentation. All attendees will receive a follow-up email with links to the presentation recording and contact information. As a reminder, you can get updates on all of the latest from HealthCheck 360 by following our LinkedIn page and subscribing to our blog. This concludes today's webinar. Stay safe, stay healthy, and take care.